Welcome to the American Academy of Grief Counseling's video on responding skills in counseling. And this can be referred to really our part 2 video on basic counseling skills, micro counseling skills, sometimes as they are referred to. And our first video, our part 1, we discussed basic attending skills where we looked at listening and observing. In this particular video, we're going to talk about now responding, the natural flux from listening and observing to actually giving a response, a reflection. And again, this is important, according to Carl Rogers, that we respond with empathy and sensitivity based upon our empathetic listening that we initially did. So, empathetic responses are important because our responses take into account the basic emotions of sad, mad, glad, and angry. We're feeding off of our client's feelings and having an understanding of how they are. So we need to show empathy in our responses. Interpersonal empathy is key for counselors. It involves having both a subjective empathy for the actual client and also an objective empathy in one's own past experiences and knowledge, and combining these two things together to communicate with the client themselves. Now, we don't want to mistake empathy with sympathy or feeling sorry for a client. Empathy is being able to feel what they feel and help them, not necessarily feel sorry for them. So when we are discussing emotion, it's important to be accurate when naming a particular emotion that an individual is expressing. Sometimes naming the emotion can also be difficult because it could cause denial, anger, or an accusation from the client themselves. So when discussing these things with them, we should only use words initially that they are using to describe the actual situation. So it's important then to use the vernacular that they're using initially to avoid them from feeling as if they are being labeled in some way. Also, it's important how we name emotions because different cultures might respond differently to different emotions being said about them. So if you have, for say, a man that is very much from a patriarchal society and you start using emotional terms that might denote what he would perceive as weakness, even though he's showing signs of depression, then that could cause a negative reaction. So that's why it's important that our responses are well thought, they're articulate, and they're empathetic to the situation, and basically paraphrasing what the client is saying. And again, that stems from good attending skills that we spoke of in episode 1 or part 1. Now, good responses are based also on good tracking skills. We want to be able to properly track the narrative. So we need to sometimes, as we listen to the conversation and we track it, we sometimes need to impose a few things to help individuals move forward in the story. So responses can sometimes help a client move forward as well as understand what they are discussing themselves. So we have 4 key things listed here on how responses can help the client. Responding to the client, first of all, lets the client know that you are listening, that you are actively engaged. It helps the story push forward and keep the client on track. It can also help in your responses recap or tie together key events. And finally, can help the client think more deeply about their comments, their feelings, or thoughts, and be able to introduce new ways of thinking about them. Sometimes an individual who says things, if it's reflected back to them, they are able to hear it out loud, and sometimes they can make a different interpretation on it. So while we're listening, we're making responses that are based off of our prompts and tracking. So here are some various useful responses that we can do. There are various ways that we can nudge or prompt a client to move forward. We can do a simple nod or a head movement, or a simple word or phrase such as yes, or okay, or a phrase such as please go on. Sometimes I see can be used, although it can sometimes be seen as a demeaning term depending on the tone itself. Another way to keep the client speaking is sometimes to restate just the emotion itself. If someone keeps speaking of how angry they are, you can simply say anger, and that can trigger a further investigation from the client to speak more about what they're feeling. So again, it's all about prompts and helping them. Sometimes it takes more than just a restatement of an emotion or a simple word or a phrase in your responses. Sometimes open-ended or closed-ended questions are very useful. How, what, where, when, or could questions. Now, bear in mind the type of question you are utilizing will also determine the response. If you use a close-ended question, you can get a response such as yes or no. So if you want more information, sometimes you're going to have a question in more detail that will involve more than a yes or no answer. So if you ask someone, were you angry on Monday? You will get sometimes a yes or a no. But if your question is, were you angry on Monday? And if so, why? That is an open-ended question, and it invites the client to speak more. Paraphrasing is another excellent response when responding to a client. When you're paraphrasing, you want to be sure to state the emotion in the terms and words that were used by the client and end it with a because statement. So if a client is angry, you can say, so you are angry because your spouse left you. And then that, again, invites more dialogue in that response. It also, again, shows that in your responses that you are listening, you are paying attention, but you're also inviting this individual to go into more depth about it. A paraphrasing type of a more detailed type of paraphrasing is called summarization, I should say. In a summary, it's a longer paraphrase with additional information and insight given by you to the client. And it can be used to start a session, or it could be start to conclude a session, or it can be also used in the middle of the session when you use your basic paraphrase and then allow the client to see a deeper or more different view. So you might state that you are angry because of this. What else would you think from this particular point of view? Or you might give a little bit about the emotion of anger and what it can do in itself. Now, sometimes there are bad responses, and this is something that rookie counselors can make that have not been counseling in a long time and they have not encountered a particular thing. One is no responses at all. Responses are important part of the counseling process. If you are not responding, then you are showing no interest at all without any physical cues, maybe a nod of your head or a simple okay. Some bad responses are also those that are maybe pretending to agree with the person and simply saying, okay, okay, I agree. And then later, when you're paying attention, you might say, well, I didn't agree with that. But the client will feel that you did because you said, okay, when you technically did not agree with the client's behavior. In those cases, you shouldn't simply say, okay, to nudge someone along. if something clearly wrong is being said. You don't want to judge yet or confront yet, but you definitely do not want to pretend to agree for the sake of agreeing itself. So you want to have good responses. You don't want to have subtractive responses that take away, but you want to have them to at least be basic and that they reflect, or additive and that they give some quality to what is already being said with the root of the issue. Now, sometimes, as we mentioned, nudges and pushes are good with open-ended and closed-ended questions. But when questions are poor, they can also be very detrimental to the counseling session. If you're interrogating or fishing for answers, this can make a client feel very, very uncomfortable. So you don't want to just simply have a laundry list of questions to make to try to push something artificially along that isn't naturally flowing. You should also avoid distracting questions that take away from the emotion and the story itself. But the question needs to be about the situation itself, not maybe what the person did or did not do, but what naturally occurred. Another thing to avoid are cliches, and I think a lot of individuals naturally do this in society itself. For counselors, they're a definite no-no. They cheapen the counseling experience, and they tend to generalize for the individual. So cliches like there's always tomorrow or things like that are sometimes things that can make an individual not feel that they're really receiving the professional help that they actually need. Now, advising is another element. Most individuals think counseling itself is an advisement process, and the counselor has to help the individual through good responses come to the conclusion that you're not going to be told what to do. You're going to be guided, and then the client makes the decision. So counselors give options, they don't give directions. And I think that's very important to remember as a counselor. So your responses have to be guiding. They have to always be, you could do this or you could do that. What do you think is best for you? And that allows the client to think more in that response in what they need to do instead of being told what to do. And telling it again, counseling is not about being advised and told or being given directions. Interpretation responses that are more about the client's diagnosis than the story itself can be bad as well. If the counselor is continually talking about a diagnosis, this labels the actual client and makes them feel weird as well in regards to how they are feeling about themselves. Again, I mentioned earlier, sympathy or feeling sorry instead of showing empathy and helping the individual to a more transformative change is important. And I think sometimes counselors in their responses can feel sorry for their client themselves. Another one to look at, which isn't listed, is parroting. So when we paraphrase, we're not technically parroting. We're saying it in a way to put more reflection on the emotion itself. But if we tend to get into a response mode where we're disinterested and we're just mirroring and parroting constantly, it can become also a type of bad response for the client and how they feel they are being actively listened to. And I do believe we talked about that a little bit in the first video. So here we look at a few things in how to respond, why responding is important, but also in responses, there is a way to do them. There are a variety of them, and they are all still part of the basic counseling experience while the story is being told itself. Below is our grief counseling certification link, as well as our mental health certifications link, which have Christian counseling, spiritual counseling, anger management, crisis counseling, and so forth. Our phone number is 330-652-7776, and our email is info@aihcp.org. And again, I'll reference the same one that we used for our part 1 video on basic listening is the skilled helper, a problem management and opportunity development approach for helping. And that's a good textbook if you're looking to really learn the basics of how to interact with individuals that you might be working with who are grieving in themselves. I'd like to thank you for listening and have a good day.